Hi all, it's Christina aka Angel Wings, and so far, well, I'm not sure if I told you guys, but I got the Depo shot when I was in the hospital on the 11th of August, and they didn't do it on my period, so I could be pregnant because I had sex like 5 days later. And I've read that it takes like at least a week for it to kick in if you don't do it on your period. If you don't get it on your period. And I'm like 51 days late for my period. So I'm really nervous, like wondering if I somehow got pregnant or something. But I also have some other news. I had a colonoscopy today, and the doctor told me he thinks I have IBS, which is irritable bowel syndrome, because he didn't find anything, and that's really the only explanation he could come up with was IBS. So, and I always kind of thought I had IBS, but never really considered it too strongly, or ever went to the doctor and said something like, maybe I have IBS or anything. So, but I'm not sure if I told you guys, but my eyes have been kind of gotten really, really blurry and double vision, and like when I walk in the dark in my apartment, like when I go to the kitchen or something to get something and get a drink or something to take my pills, and then I turn all the lights off and I walk to the door, to my bedroom door, I see like red, and I don't know why. It's like everything's red tinted in the dark, and I don't know why. But they're sending me to an ophthalmologist. I have an ophthalmologist appointment on the 26th of September. And hopefully they find out what the heck is wrong with me, because it all of a sudden started. It didn't just like gradually, happen. I just all of a sudden couldn't see up close. Like, I looked at my phone one day and then I couldn't see it close at all. And it was like double vision. And also, if you can tell, look at my eyes. See how like dilated they are? They've been like that since I have had the eye problems. And my doctor thinks it's weird. And then this other doctor I saw thought it was weird. So she made a referral to an ophthalmologist. And I get to see him on the 26th, like I said, of September. So, but I'm really, really worried I'm pregnant because it's been 51 days. And I know that the Depo shot can cause you to lose your period, but I also had like sex like 5 days after getting it, and I wasn't on my period when I got it. So, I'm just kind of worried. Because I know I read somewhere that it takes like a week or something if you don't get on your period to be affected. So, I'm thinking about taking a pregnancy test again tomorrow. It's been like 9 days since I had my last pregnancy test. And I've had like 4 pee tests and 1 blood test, and they all come negative. Now I know that I've read places that a lot of women don't even come up with high levels of HCG for some reason. Well, not really a lot, but some women come up with low levels of HCG, and they can't. The pregnancy tests don't detect them. And sometimes they have to get an ultrasound to find out that they're pregnant. But I'm hoping that's not what's going to happen with me. But I just wanted to make an update. I have found out I have IBS, which is irritable bowel syndrome, which is what I said. And I could be pregnant. And I think I'm going to take a pee test in the morning and see what it says. And then I have an extra pee test. I have like two pee tests by Clear Blue or something. I think it's called Clear Blue. I don't remember. It's like a really good brand. It's the electronic one where it tells you like how many weeks you are along. So I'm hoping that it actually says pregnant. I know it's crazy, but like I kind of want to be pregnant, and I kind of don't want to be pregnant at the same time. The reason I want to be pregnant is I kind of want to experience what it's like, because I know a couple people that have gotten pregnant, and I know I've watched videos of people on YouTube doing their pee tests, and it comes up pregnant, and it just makes me kind of jealous. So, I want to have that experience, you know, but I don't necessarily want to keep the kid because I couldn't take care of it. Is that weird? Probably. But that's just how I am. You also have to take into consideration that I have mental issues. So I'm not going to think as brightly or as good as a normal person. So yeah. And if you haven't watched my other videos, I do have bipolar disorder. I have borderline personality disorder, possibly PTSD, which I was told was put on my file. And I asked the doctor about it, and he says it's not in my file, which is fucking stupid. And the doctor thinks I might have social anxiety disorder, but he's not gonna put in my diagnosis for some fucking reason. But and bipolar, I'm type 2. At least that's what they say. Well, no. Now that I think about it, no. The doctor I talked to said I was type 2. Like, she said I was type 2. But actually in my records, it says, I asked the doctor, and it says I'm unspecified. Bipolar disorder unspecified. Which I don't get, but especially since she told me I was type 2. It's just like, I don't like being lied to. But I have mental issues, and, you know, I kind of want to be pregnant, I kind of don't want to be pregnant. And, like, if I am pregnant, it's going to be kind of exciting, I guess. Because I kind of want to be pregnant, I want to experience that, you know, for once in my life, just one time. Even if it's, like, the most painful thing I've ever experienced, you know. Especially when I'm having the baby. But, and if I did get pregnant, I would adopt it out, but I would have, if possible, an open adoption, so that I could see the baby, and see my actual kid. I wouldn't just, like, throw it away, basically. I would actually, you know, get to see how it's growing up and everything. I'm not gonna, like, just throw it away and forget about it. But my video's going on like 8 minutes and 33 seconds, so I gotta go. See y'all later.